Hello, and welcome to the virtual tour of Fairbanks Memorial Hospital's Women and Infant Services. Our vision is to elevate the standard for family-centered, community-focused care by your friends and neighbors. And that's what we are. Our OB techs, our nurses, our midwives, and our doctors live right here in our community. We and our families and friends receive our care here, and we strive to make it the best care possible. When the time comes to arrive at the hospital, depending on the plan that you've made with your provider, please enter through our emergency room entrance and check in at our front desk. There you will get registered and sign a consent for care, and the registrar will call one of our WIS RNs to come down and escort you upstairs. We encourage you to have a support person with you, and we welcome them to be involved in your care throughout your stay. That involves the care of you and your newborn.
If you're here for a scheduled induction or for a scheduled C-section, you will go to a private room. We'll take you there. But otherwise, you're going to come to our triage area. Our 3-bed triage area, it's a semi-private part of the Women's Center at the L&D unit. Depending on your situation, we can do a lot of different services and tests while you're in triage. For example, we can get vital signs, we can run lab work, we can do ultrasound. Frequently, there's a cervical exam to assess your labor progress. We have electronic fetal monitoring. It assesses your baby's heart rate and your contraction pattern. We also have central monitoring. It provides for patient safety and gives you peace of mind during the labor process. Once your provider determines that you're going to stay at the L&D unit, they will admit you and will take you to a private room. Once you get into your private room, your nurse will help get you oriented to the room, get you settled in and comfortable so that you feel good waiting to meet your little one. If you have a birth plan that you would like to share with your healthcare team, you're welcome to bring it. We'd be happy to read it. If you have any questions or concerns about a birth plan, talk with your healthcare provider to see what's going to suit your needs best.
Whether you're planning a vaginal or cesarean delivery, your room is fully stocked with amenities that are meant to keep you and your support person comfortable. These amenities include a private room and shower, a convertible bed for your support person, products for baby care, but bringing your own baby bag is okay. We also include hygiene items for you and your support person, as well as breastfeeding-friendly gowns and breast pumps if desired. For pain control options, we have pharmacological options such as an epidural, IV pain medication, and nitrous oxide. Some non-pharmacological methods we have include aromatherapy and hydrotherapy tubs. And please speak with your provider if hydrotherapy is something you're interested in to see if it's an appropriate option for you. We also have positioning aids for labor, including a birthing stool, a peanut ball, squat bar, and a multi-positional bed. How we keep you and your baby safe is using a Hugs and Kisses technology. These bands are applied 2 hours after birth to you and your baby, and we make you guys a matching set, making sure that your baby will not be taken away from the unit. If C-section is your mode of delivery, this will take place on the WIS unit. The first hour of recovery from your C-section will be in the post-anesthesia care unit, or PACU, directly across from the OR. Either in the OR or the PACU, we're able to support skin-to-skin care as well as breastfeeding in both locations if that's your desired birth plan. Your length of stay will change depending on whether you're a vaginal or cesarean delivery. Our length of stay for vaginal deliveries is 1 to 2 nights, or 2 to 4 nights for cesareans. Rooming in is the standard for all babies that do not require NICU care. Throughout your stay, you will be educated about how to care for your baby as well as yourself.
Sometimes in life, our plans don't go the way we expect them to go. There can be challenges during pregnancy and delivery. And while we hope you don't require the services of our neonatal intensive care unit, we are available around the clock to support the special needs of your baby if you do. Parents, we want you to visit your baby as often as you would like. We are open 24/7 for you. We do have limited visitor restrictions, however, and no children under the age of 18 may enter our NICU. We also want you involved in your baby's care. So as your baby's condition improves and he or she becomes more stable, we encourage you to hold and feed, change diapers, and bathe your baby and learn all of the things that you need to do to be able to comfortably take your baby home. We have a variety of specialty staff that you will meet during your baby's stay with us. Our nurses are specially trained to take care of our tiny babies, and we really enjoy what we do. Our social workers are able to connect with you and see what kind of needs you may have that come up during your stay. Our lactation nurses are all IBCLCs, and we can check in with you frequently to make sure that your feeding journey is going well and helping you meet your goals. We also have developmental therapists who will help you with holding and feeding your infant and teaching you how to read your baby's cues so that you can understand how your baby is communicating with you. Our birth registrar team will help you fill out the birth certificate. A car seat specialist is available to make sure that your car seat isn't expired or is not on the recall list, and to make sure that your baby fits well in the car seat and safely. We have a great team of physicians who collaborate with you, the parents, as well as the nurses and all the specialty staff to help your baby as he or she gets stronger and makes a safe transition to home. And speaking of home, we want to make sure that goes well also. Our nurses will give you a call to make sure that your transition to home has gone well and that you and your baby are doing well. There will be a follow-up appointment made with your baby's provider to make sure that your baby is growing and doing well. We also have new parent clinic by physician order and by appointment. And we again just make sure that your feeding journey is going well, and if you have any questions or need more assistance, and then any referrals that need to be made, we will begin that process in the hospital. So referrals for hearing or developmental progress or specialty clinics, we will get that process started for you, and then your baby's provider will continue that process after discharge.
Thank you for taking the time to watch our tour and learn more about the Women and Infant Services at Fairbanks Memorial Hospital. We look forward to meeting you and caring for you and your baby.